Welcome to the episode of Medscope. Today, I'm thrilled to have Dr. Esat Guney. In this episode, we'll dive into the incredible work being done by the Whitetulip Health Foundation. Whether you're a student in the field or a high school student interested in medicine, or just someone passionate about making a difference in the community, this episode has something just for you. Mr. Esat, would you like to introduce yourself?
Hi, my name is Dr. Esat Guney. I've just started my residency in psychiatry in St. Luke's. I'm very interested in the Whitetulip. I'm actively, especially within the high school student zone, and I'm happy to be here. Thank you.
Of course. So you are one of the basis founders of the Whitetulip Health Foundation. Could you talk a little bit of how that inspiration came to be?
Yeah, absolutely. So I do know that before I came here, maybe like 10 years ago, Whitetulip had been found by many of the doctors whom at the meantime were studying for the board exams and was also having some financial difficulties, learning that this was a problem, and within a scholarship program, they would be easily having the new generation of doctors that are coming here, maybe having the financial difficulties as well, along with the academical struggles, would help them, whether it be the scholarships or the any kind of mentoring, especially these exams and applying to residencies and all that, as that was what was most important for us as international medical graduates, with many of the new generation also wanting to be within the medical field as a high schooler and also in university, and with the growing Whitetulip, which has been across the United States, more than 500 volunteers as of now, has been also included many departments, including the pre-meds and the high schooler, as we know that the high school is actually where you want to improve yourself, that you can have a higher chance of getting into med school.
Yeah, thank you so much. So it's clear that the Whitetulip Health Foundation, or shortened as WHT, has grown tremendously and vigorously since the inception. How does WHT empower healthcare professionals, especially immigrant doctors, today?
Yeah, absolutely. So like I was mentioning, like the difficulties, especially coming from abroad, us not knowing the system was something very challenging, and within the doctors who already are a doctor here helped us a lot. And I guess what the motivation was, like I was mentioning, the way that I also received scholarship and I had mentors that helped me through my board exams. I saw that, hey, there has been this much of an impact on me. I also want to share this with the new generation, and with its new generation, mostly in the high schools. That was the reason that I wanted to be more involved in the high schoolers.
Mm-hmm. Definitely understandable. So Dr. Esat, you had mentioned one of the goals in WHF. Another major goal of WHF, as you have mentioned, is to serve the disadvantaged community and the minority communities. And how is that being done or being concluded so far?
Yeah, definitely. So like we were talking about, there's a variety of departments, near 20 as of now, including global, as upon the COVID pandemic, we know that there is a need with the virtual, as we had implemented that within our system, along with the earthquake in Turkey and Syria, which we also try to help many, including our virtual sessions, including the mental health care, which we did with the psychologists and psychiatrists within the Whitetulip, free consultation and even free sessions to many. Not that, but doing it on a global scale, continuing to, as we had done many mission trips to Africa and many other countries. This had also been giving us the opportunity to have our volunteers in the medical field, the doctors, the nurses, and even with the interns like you as university students, has also been involved in these projects, which are also helping them apply to med school or nursing school, or whatever field they want in the medicine as a broad field. But also we have projects to include high schoolers in the future within these projects, as there's each year a new global mission as well. Not that, but doctors like me who graduated from medical school from abroad has many different difficulties adjusting to the system here, because we did not learn the system as the medical students do. So one of the things that Whitetulip had come up with was the intern preparation program, where with the volunteers of Whitetulip, the doctors had been training the newcomers of the residents, the ones that are going to start as an intern within weeks of program in the 2 to 3 month time frame, helping them helping them with lectures, including writing notes, how to engage with the patient, some of the most important diseases and how to manage those using the healthcare electronic medical record system, mostly the EPIC, which many of the hospitals are using. And even though the residency training programs are including these, many might lack the training that especially medical school students from abroad might not have, and we are trying to fill that gap. And that brings us to the high school student zone, where we wanted to help the high schooler students, especially ones whose families might have just come to the United States in the last couple of years, and they might not know, as someone whose family is already a doctor in the United States. And we try to help many of those students acclimated to the system, to the medical fields, and we try our best on that.
Thank you. And one of my following questions was about that, so we'll get to that one later on. But we have seen WHF involved in various health education initiatives, as well as medical assistant programs. Could you tell us a little bit more, or some of WHF's recent projects in the years, especially with its adaptation to outreach after the COVID-19 pandemic that we faced recently?
Yeah, definitely. So the COVID, like we were talking about, the virtual programs that we try to do, and within the orchids, and can you repeat the question again?
Definitely. So we've seen WHF involved in various health education initiatives and medical assistant programs. And could you tell us about some of the recent projects with outreach and adaptation with the pandemic of COVID-19?
Yeah, definitely. So one thing that we implemented was having these virtual sessions within our free clinic, as we know that due to COVID, there might have been a lot of patients that want to see a doctor, and this is actually very important in cases where they just need a primary care to maybe prescribe their medication, especially if this person is coming from abroad and has not a doctor or an insurance here in the States. And this free clinic has been helping that as well. And some other things within the medical assistance would be us trying to help, especially with the Whitetulip website. We have the interns manage these, we have the interns helping us create the websites, including all these medical assistance programs that we talked about within their state, whether it be programs about how to find their free clinic, or in a way like a social worker, trying to get them engaged within the healthcare through the insurances and how they could do that. So this has been something that has been studied. Something new as is studying and is being worked on, like this retreat here, is to go on retreats across states and explain Whitetulip, explain healthcare to people, especially coming from abroad and not knowing the system. So there is a lot that is going on. There is many new projects, and luckily this would be with the word of mouth, getting more engaged within the community, because we want to be within the community. We don't want to be a standalone Whitetulip.
Definitely. And so, looking ahead with all these projects being done, what are the future goals of Whitetulip Health Foundation, and what do you see the organization evolving into the next upcoming few years?
Yeah, so this has been some thing that was especially on my mind, especially the last year or two maybe. So the way that Whitetulip was created was mostly international medical graduates, especially within the last 5 years. They were helping many accreditate, like we talked about, within these mentorships to scholars and the interpretation programs, even the academic and faculty level mentoring and networking collaborations, all that. But what I see in the future is many of us, not me, obviously not that, I might be a bit younger than the doctors and that are volunteering Whitetulip, but what we see is there's a lot of children that are interested in medical field, and I see this as something uniform. If you're having a family within the health industry, the healthcare system, you're more engaged within those, and maybe you want to become a physician assistant or a doctor or a nurse. So seeing this, we want to in the future transform ourselves within the new generation, this being the high schoolers, the university students, and transforming more English-based presentations, which we currently are doing with the high schoolers. So what I see in the next 5 to 10 years is transformation of Whitetulip from the international medical graduates, helping the international medical graduates, to the first the international medical graduates helping the children, but then likely you would be within the medical field in the 5 to 10 years, and you helping the youth, the medical students, and all the way from high schoolers, helping them as you already had faced those difficulties, the same way that the first doctors 10 years ago in Whitetulip helped this Whitetulip be formed.
Definitely. And you mentioned some of these future goals are also being presented right now. For instance, with the high schoolers, would you want to mention about the high schoolers and their programs going on?
Definitely. So due to our so what happened was a lot of the medical field, like I was mentioning, the children of them, the first knowing of Whitetulip, especially on the high school student zone, would be all across the states. So this had some difficulties, some cons, but also some pros as well. So what was the reason is when we try to get into the healthcare system, it's that we apply everywhere, literally everywhere, and we also have some considerations, but there might be people that are living in New Mexico, Pittsburgh, New Jersey, Florida, Texas. So we're all around the states. Due to wherever work or residency we find, we try to go there. And also with the fact that each one of us has something in our interest, that being that could be a field within neurology that we think Pittsburgh neurology is one of the best in vascular, etc. And we try to go there. So like I was mentioning, this has made it so that the high schoolers that are knowing Whitetulip are all across states. And although it did have the difficulties of not being able to meet each other that much, it made us that we would be relying on the virtual systems such as Zoom, but also with the pros of all our volunteers, the doctors, the nurses, the PA student we have, or many other fields like the psychology, the physical therapy are available within virtual, because wherever they are in the States, we could contact them, say to them that we would want them to network with our high schoolers, and they would be within just opening their laptop. So I think that was something that's great, and luckily, within our new program within the high school student zone, we want to use this even more. And you might have also maybe looked at our annual report, seeing many and many of the presentations within a variety of topics. Last one was a nurse practitioner mentioning how to be a nurse practitioner, or the other one being why healthcare, including all the subjects. So we want to have our high schoolers know just not being a doctor, but broader medical field, as we know that this is not just a doctor, but it's a team, and we want to work with everyone within the field.
Yeah, thank you so much for sharing these incredible insights. One of my final questions about the Whitetulip basis ideas or questions would be, how could our listeners and fellow healthcare professionals contribute to WHF's mission?
Yeah, definitely. So the way that I saw it, and this had been the case for the last couple of years, was that the more you get, like me, getting all those mentors, the scholarships, and seeing these fabulous events, I just wanted to contribute more. And I think this is something as within many of the advertisements within our global world, and everyone just maybe for money or for other purposes trying to attract people. I guess the best way is in-person connections, and this is important in ways that we could spread the word with the word of mouth, let our friends know. But like I was mentioning, because Whitetulip is not something that is known very much, and with these kinds of podcasts we're trying to contrast that, try to be more within the community, especially within the high schoolers. But what I was thinking was with many of the students that we have right now, and them sharing all their information to their friends, and sharing the benefits that they had within Whitetulip, is just with the word of mouth. We just be greater with time, and thinking all this, and seeing many of the presentations and the great feedback, I believe it's most important to devote ourselves to the work we're doing, and then the crowds will just be coming in the future. That's what I think.
Yeah, thank you so much. So now we're moving on to our second part of this episode, and that is talking a little bit more about who Dr. Esat Guney is. So could you mention a little bit about yourself and how you came to the field, as well as, we've always hear these consistent theories about how to become a doctor, but the reality or more aspects of your tips and tricks on how to achieve this.
Yeah, definitely. So what I was born and raised in Turkey. Although I was here in the United States when I was a kid, that was like in 4th grade to 6th grade. That was in Virginia, as my father had some mission here in the NATO. We went back to Turkey, but I love the American culture, the system here, and I also always wanted to come back here at some point. But my father also being within the military, I was also interested in the military school, and with my interest in medicine, I guess I just combined them both, went to the military medical school. Upon all the political issues within Turkey, again, my interest became back to being in United States, and as someone that's already finished the medical school, I just came here, continued to do some of my elective clerkships here, especially in Mount Sinai, getting the examinations, such as the board exams, and with the financial struggles, I was even like working as a cashier at a pizza place for some time, for example, or doing some food delivery in the meantime. With time, I got more engaged with giving the exams, being involved, especially within the medical scribe and medical assistant. And one of the medical assistants I was doing was actually in the Whitetulip Free Clinic. I was able to get more engaged within the system, also within another hospital, preparing the discharge summaries. That led me to meet a doctor, a psychiatrist there, and I also wanted to do psychiatry, and spending time with him, seeing the patients together. There another doctor who was doing a virtual, and another doctor who was seeing the patients virtually. and the hospital wanting me to be the telepsych coordinator, as I would be preparing the patients for that virtual session with the psychiatrist. So what I look back is one thing always led to another, and I was always trying to do my best, and thus had some difficulties, such as within psychiatry there is so less scribe or medical assistant, as psychiatry is not a field that is that much interested in the vitals or blood work as compared to other fields. So I had this difficulty, couldn't find any jobs, but then I said, hey, let me just get into this field wherever I can, and I just started doing some scribe work with an excellent doctor in oncology, and then I was able to find one in surgical intensive care unit. Then I found myself within the psychiatric hospital doing those discharge summaries, and my previous scribe work had helps me get into that position within the psychiatric hospital. Maybe that position in the psychiatric hospital led me to get this residency. So what I was seeing is, even though I had many of these challenges, I did not want to give up. I just tried to find another way, and I did not want to give up. I just want to find another way and just go through another phase. And it's very inspiring how things that you did not consider in the past, like that scribe work in oncology, helps you crucially as that extraordinary doctor. I learned many of the bedside manners that I might not have learned from a psychiatrist, and being more engaged within the psychiatric realm, I saw myself, okay, I feel that I'm a good candidate for a psychiatric residency now, and let me just apply, which helped me luckily within a program that I'm very in love with right now.
Yeah, thank you for mentioning your psychiatry residency right now. So we are aware that you are a psychiatry resident. Could you talk about what made you choose psychiatry, or in other words, what led into psychiatry? You said it was kind of more of a door led to another door, but more rather than what attracted you to the psychiatry department itself.
Definitely. So as you might also know, and like many people within the medical school interest, we need to have our CVs, have our letter of recommendations, and prepare our personal statements. And one thing that's common is within these personal statements have someone that has a psychiatric condition, such as my uncle having schizophrenia, that led me to the field. This had not been the case for me, but it was more of so we had the clerkships within our 5th year, the psychiatry. We had some introduction to clinic lectures within our 3rd year. Our school system is 6 years, but seeing the psychiatric realm with those medications, helping psychotic patients in an instance, what I mean by instance is you see a patient that has some delusions, just feeling unreal thoughts to be the real case, and the fact that the medications helping on an extraordinary level, seeing the medications help them within days of them having solved their delusions, or if they're very anxious, depressed, the medications helping them with those psychiatric conditions. I felt that this area is something very extraordinary, something very amazing, and I just wanted to be a part of this field.
Yeah, that's a lovely answer. Thank you so much. So, to our listeners, I hope that this conversation found an inspirational as I did. And remember, you can follow us on Instagram and our social media accounts. And to learn more, go and visit the WHF or Whitetulip Health Foundation website. See you next time.
Thank you.